If you're interested, you have to ask questions of your doctors. If you leave your doctor-patient relationship and say, I really wanted to ask, but I was afraid, shame on you. Doctors work for you, okay? Last time I checked, I didn't give you $60 for a follow-up visit, okay? We work for you, like a lawyer, like an accountant. So if you have questions, ask. If your doctor doesn't want to answer the questions, get a new doctor, okay? Any doctor who's afraid of a second opinion, in my opinion, is either hiding something or not willing to share with you what they know. So I think that you have to have an open and honest relationship with your doctors. Now, that doesn't mean you have to go assault them, okay? They're your partners and they're trying to help. And it doesn't mean you have to change your personality. If you don't want to know, don't ask. But don't live in regret and feel that you couldn't ask. That's probably the most important thing. One of the things that I think is very important is to be open. If you're going to have an open relationship, first thing that comes up, everyone who has cancer is taking something. Whether you tell me or not. If you don't tell me you're taking something, then I know you're lying to me, okay? Everyone's taking a little green tea, maybe a little bit of mushroom extract. Oh, I had a liver cleanse, okay? Everyone's taking something. But if you don't create an environment where the patient is willing to share, if the doctor's not listening, then I'm not going to know that you're taking something potentially dangerous or something that could negate, nullify, or make worthless the treatment I'm offering. The best example is chemotherapy, in a broad sense, works by, let me back up. A lot of people like something called antioxidants. You can read about them, go to a health food store, antioxidants, because I don't want this oxidative problem, this chemical reaction that causes a problem. Well, a lot of chemotherapy works through what doctors and scientists call oxidative stress. But if you take a bunch of antioxidants while you're taking chemotherapy, you may nullify some of the benefit of that chemotherapy. And there's certainly foods and TCM or a variety of alternative things that you can take that not just nullify, but actually could be dangerous. The best example is that, of all things, grapefruit juice has terrible interactions with lots of different drugs. And if you're taking a lot of medicines, you probably should never take grapefruit juice because it just sort of changes the way your liver is going to look at the medicine. And that means that for some people, you'll get too much medicine, and for some people, you won't get enough. So you need to have, as the doctor, we need to create an open relationship so that you can tell me, well, I really want to take shiitake mushroom extract. And I'll say, you know what? When we're done with the chemo, I think that it'd be just fine for you to take that as a preventative. Or, I want to take acupuncture with Dr. Wynn. That's always great. That's something that doesn't interfere. That's something that we can use for pain, for nausea, for anxiety. There's a lot of different alternative and complementary approaches we can incorporate, but if I can't create an environment as the doctor where you're comfortable, then I've missed a healing opportunity. So this is my last slide. I put up a few common questions or scenarios to maybe jumpstart some of your questions. For example, a doctor has given me 2 choices for the treatment and says the decision is up to you. Okay? Has anyone had that happen where the doctor's had a couple of choices and they say, well, what do you want to do? And your answer should be, well, I don't know. I didn't go to medical school. You're the doctor. In the U.S., we practice much more participative medicine, where patients come in with 20 pages of Google searches and a textbook from the Mayo Clinic and tell us what they want. That's fine. What we need is that dialogue, and we need to be able to separate the good information from the bad information. But at the end of the day, yes, I am the doctor, and I will give you 2 things. I will give you my opinion, and I will tell you what to do. Unless you feel so strongly about what you want to do and it's safe, I'm going to make my recommendation. It's up to you to take it or leave it, and it's up to me to give you a fair recommendation and not bounce around and say, this is your choice. Which one do you want to do? Another common problem. We use a word, a phrase, statistically significant, meaning in the study of chemo and hormones, there was a statistically significant advantage for the group receiving chemo. What does that mean? That means mathematically it's better, but there's also clinically significant. For example, will you be older tomorrow? Yes, that is a fact. You will be statistically significant older tomorrow, okay? Will you be meaningfully older tomorrow? Is that a meaningful amount of age? And the answer is no. So sometimes we have to help patients distinguish between what has been shown mathematically and what is the best choice for you in the world that you live in today. Staging. Sometimes you'll read on a report, my tumor is a stage 3, but they told me I'm stage 2. I was stage 4, but now they tell me I'm cured. I don't get it. It's complicated. It's half of medical school and oncology training is the staging alone. We have different staging for different diseases. We call the tumor one stage, but the group another stage. And what you need to know is to ask your doctor to write down what the stage is and what are the appropriate treatments for that stage. What are some of the thoughts going through the doctor's mind if that's what you're interested in knowing, if you've gone down the road of asking what does the staging mean. A lot of patients don't want to take treatment because of side effects. Well, that makes good sense. I'm glad that everyone's paying attention, but not taking treatment also has side effects. So inaction is action. By saying, I won't do this, you've made a very clear and poignant decision to go down a different road. And that's as much of a choice as anything. But inaction is also potentially going to cause side effects. What are the side effects of treatment? What are the side effects of an untreated cancer? It's very clear in lung cancer, for example, that even patients who don't get extra life from treatment, they get a better quality of life if they get chemotherapy when they're newly diagnosed. So it's about quality, not always quantity. What does being cured mean? Typically, we say 5 years. If there's no evidence of cancer at 5 years, you're cured. There are rare occurrences of some cancers between 5 and 10 years, and there are some cancers where we're always on the lookout. Kidney cancer is notorious for coming back 20 years later, unexpectedly. But that aside, give yourself 5 years. If there's no evidence of cancer at 5 years, consider yourself cured. And my favorite one is, my auntie, she's older. Could you give her a smaller dose? The reality is that the doses are designed based on size. So you get the same dose whether you're 2 meters or 1.5 meters. It's the dose for your size. And if we cut down on the doses to minimize side effects, then what actually happens is you get side effects without benefit. So we're really good at calculating the doses and adjusting doses for patients with problems, but we don't like to dose down because we think that someone is older or smaller or bigger. We always dose based upon their size and then make adjustments as we go. So those are the questions that I usually hear. With that, I'm all done. Thank you.